Hi there! In this video we talk about type 1 diabetes. If you have type 1 diabetes, what exactly should your blood glucose be? I should say I do not have a medical degree, but in this video I'm going to talk about a research paper that explains what the blood glucose values in type 1 diabetes ideally should be. I'm a psychologist and I'm interested in this because psychological well-being plays a role in this as well, as you will see in this video. Now the question is, what exactly do the clinicians say and how do we know? Well, there is a so-called consensus report, and that's written by Professor Richard Holt and colleagues. And this was published a couple of years ago in a journal called Diabetes Care. Diabetes Care is one of the leading journals about diabetes. The title is The Management of Type 1 Diabetes in Adults, a consensus report by the American Diabetes Association and the European Association for the Study of Diabetes. Now in this paper they go into all sorts of issues related to the adult care of type 1 diabetes. Part of this is about the ideal blood glucose values. Now in the paper they say diabetes self-management is like walking a tightrope, and I think that's a really good analogy. Anyone who has type 1 diabetes knows how difficult it is. They write, the cornerstone of type 1 diabetes therapy is insulin replacement, and what they mean with that is that because the body doesn't produce insulin, you need to inject it. This is challenging because insulin demands vary widely according to meals, exercise, and many other factors. Furthermore, the insulin doses needed to prevent hyperglycemia, so high blood sugar, are associated with a high risk of hypoglycemia, low blood sugar, leaving people with type 1 diabetes walking a tightrope between high and low glucose levels. Now, in their section 3 of the paper, which is around 6 pages, they say how diabetes type 1 should be managed. It focuses on the ideal blood glucose values, which this video is about. They also mention 3 aims to manage type 1 diabetes. They say, of course, people should take insulin to stay in the ideal range. That's sort of like obvious. They say it's important to manage cardiovascular risk factors, and with that they mean people should keep an eye on blood pressure and so on. And the treatment must support well-being and reduce burden. So the treatment should not be so difficult that people get a burnout or something like that. They also say, and I think that's quite interesting, management strategies should adapt to new therapies and technologies as they become available, according to the wishes and desires of the people with diabetes. This is interesting because diabetes technology, fortunately, has improved a lot in the past decade or so. They also say doctors should consider individual factors when setting glycemic targets, and that means people might have another illness, or there might be an issue around psychological well-being, which just requires different targets, maybe ones that are less strict and so on. The main point is that they say here are the 7 targets that may be appropriate for most adults with type 1, right? The focus is on most adults with type 1, so remember that when you look at this. So the first target is to have an HbA1c below 7% or 53 millimoles per mole. That corresponds roughly to an average blood sugar of 8.6 millimole per liter or 155 milligrams per deciliter. In this video I will put in green the millimoles per liter and in blue the milligrams per deciliter, because in different countries people use different measures. And they also say people should test their HbA1c every 3 to 12 months. So if it hasn't been tested the last 12 months, so you go to the doctor. The second target is the time in range. The time in range should be more than 70% of the time, and the ideal range is between 3.9 and 10 in millimoles per liter, or 70 and 180 milligrams per deciliter. Now 70%, if you look at one day, it would mean that should be 16 hours and 48 minutes in one day. But, so if you look at it, on a day-to-day basis, that's sort of like then something I think is workable. They don't say that per day, but I just added that. It's sort of like, what does it actually mean? 70% of time. Target 2 is a little bit refined before and after food. So before food, they said the blood glucose value should be between 4.4 and 7.2, or 80 and 130. And after food, it can go up to 10 or 180. They say for people without diabetes, the ideal is that it stays below 7.8 millimoles per liter, or 140 milligrams per deciliter. But that is for people without diabetes. Target 3 is the time in hypoglycemia. They say that's less than 4% of the time. Now 4% on a day-to-day basis, 4% in one day would be 58 minutes. So on an average day, less than 58 minutes should be at maximally below 3.9 or 70. And the reason why this is relatively low percentage is, of course, because hypoglycemia is acutely dangerous, because it leads to confusion and people can be slower, can fall or something like that. Target 4 is for very low blood sugar, and that should occur even less. That should occur less than 1% of the time. So on a day-to-day basis, 1% of the time, that is no more than 15 minutes in a day below 3 or 54. So that's about hypoglycemia. So now we move to hyperglycemia, high blood sugars, targets 5 and 6. So first of all, they say blood sugars over 10 millimole per liter, or 180 milligrams per deciliter, should occur less than 25% of the time in a day. 25% of the time means on a daily basis less than 6 hours in a day. And then for the very high blood sugars over 13.9 or 250, depending on what system you use, that should be less than 1 hour and 12 minutes in a day. If you look at it on a daily basis, so because otherwise, what is 5% of the time, right? That's roughly for one day. That would be 1 hour and 12 minutes. Diabetes educators in the UK, and that's not in the paper, but they recommend to use a ketone test strip to see if you have too many ketones in your blood when you go over this. If you haven't done a diabetes education course and you have type 1 diabetes, I would recommend it. In the UK, there is the so-called DAPHNE course for type 1 diabetes. Highly recommended. Target 7 is that the variability of your blood sugar should not be over 36%. This is actually a number that you might not be aware of, because it's not, I'm not sure if it shows it on the apps. Some apps do maybe show it. It is the standard deviation of your glucose values divided by the mean glucose. And basically what it means is that your blood sugar, if it goes up and down too quickly, too often, they say that that's not good. It should, and the 36% is sort of like the maximum value for that. But again, I mean, that's something that might be difficult to find out. You might check if you use a glucose sensor, check if it shows that. Now, they also have some targets for blood pressure for most people with type 1. Below, blood pressure should be below 140 or 90, or for those at more risk, below 130/80. They also recommend to consider antiplatelet and statins for certain groups. So if you haven't gotten those, discuss that with your doctor. So that's it. Now the question is, what do you think? Do you think these targets are reasonable, or are they too difficult, or do you maybe manage that? Do you know actually what percentage of the time you are in range? Leave your comments below the video, and please like and subscribe to this channel.